Maria from Russia. I'm in despair. After facial paralysis a year ago, my face still becomes worse, more and more tight areas, less and less symmetry. Will it stop? The left side has lost its weight. Well, I have to say that the process of recovery after acute facial palsy indeed continues for quite a long time. And usually by the year mark, it more or less stabilizes. Usually, synkinesis start to manifest themselves within 3 to 4, sometimes 5 months since the onset. By that time, the recovery has taken a great deal place, and the movements have returned, most of them in any case, usually not in full scale, but the synkinesis start to develop after those movements have returned. And of course, we now understand why, because with the return of the facial movements, the brain starts to receive positive feedback to its very high intensity efforts and starts to solidify these habits in the new mimetic pattern, and that is, for that matter, synkinesis. You can see here that on this, even on this slide, it's the same patient on the left, pictures with a blue vertical line. You can see the face of this patient live, so to say, as it is. We don't often realize that left and right side of her face, which is right side, this one is an affected side, and the left side is a healthy side, are showing totally different pattern of the facial expressions. If you look at the next pair of pictures, with the green vertical line, you can see what the healthy side of the face is showing if we mirror it to the other side. Just quite normal, regular facial expressions of the eyes being squeezed. And the last one, the right-hand side picture, shows the affected side of the patient mirrored to the healthy side, and you can see that the pattern is totally different, and it really indicates a great deal of effort that the patient is exerting, actually the patient's brain is exerting without conscious participation of the patient's mind. And we can see that everything is now engaged. Yeah, you can see that, and the eyebrows are trying to go down. You see the movements, the efforts of the circular muscle of the eye, and the frontal muscles trying to pull up, and the zygomatic muscles are trying to smile, and the muscles that pull down the mouth corner, and the chin muscle mentalis. All of it is engaged, although under the normal circumstances, here under the green line pictures, they should not be there. And it's called reciprocal inhibition. And normally, when I flex my arm, the biceps contracts and triceps relaxes. It becomes automatic. It's an automatic process, which is called reciprocal inhibition. So when the agonist muscle contracts, the antagonist muscle relaxes. This is an automatic process, and it's under normal circumstances, it exactly takes place also in the face. When we squeeze our eyes, the antagonist of the circular muscle of the eye, the frontalis muscle, the forehead muscle, must relax. Only when we smile, the muscle pulls down the mouth corner. Antagonist of the smile muscles should also relax. But in the absolute majority of the cases in the patients, you can also see it with a smile here very, very clearly. It's not the case on the affected side. The muscles antagonists involuntarily contract, which means that, and the brain is trying to overcome that involuntarily resistance and exerts higher efforts and yet higher efforts and yet higher efforts. And we get the motor overflow, the cortex becomes overexcitated, and the excitation spreads to the other muscles. And as you can see here on the picture of the smile, the affected side eye becomes smaller. The eye fissure becomes narrow because involuntary contraction of the circular muscle of the eye leads to synkinetic movements. Patricia from Austin, United States has asked, I have had Bell's palsy 3 times now. Does this happen often to other Bell's palsy patients? Well, the statistic says that relapse of facial palsy, especially on the same side, happens very, very rarely. It's a fraction of a percentage. Although, well, you have been evidence that statistics can hit a person with a recurring Bell's palsy. It could be due to several reasons. Sometimes recurring Bell's palsy happens with a person who has other family members with the same facial palsy history. It could be due to some anatomical particular anatomical difference or particular structure of your channel where the facial nerve is situated. It could also happen if you have herpes virus. It could be recurring due to eruptions of herpetic infection. And very seldom it happens due to other reasons, but it does happen. And Bell's palsy, the name Bell's palsy, actually it is a diagnosis of exclusion. What it means? That means that if the actual cause of the facial palsy cannot be established, it gets the name idiopathic facial palsy or Bell's palsy. In other words, the name Bell's palsy means we don't know what has caused the damage to your facial nerve. Ahmed from Jordan is asking about my situation, if there is any way to decrease Bell's palsy effects, especially Bell's palsy with me from a long time, about 29 years. We already discussed this topic in the beginning of our session. Yes, for the reversal and the reduction of the symptoms, time is, with our method, time is not a critical factor, Ahmed. That's why the answer to your question is yes, there is a way. It is not simple, it's not easy. I've been explaining it quite extensively already during this presentation. We don't have a one-size-fits-all recipe, and we don't also have a magic exercise that will reduce or eliminate your synkinesis within a week or 2 or 3. It's a coordinated effort between the specialist of the clinic and the patient, and it requires daily work, daily practice, concentration, persistence, perseverance, and so on. But it is possible. Jill from the United States is asking, I've had Bell's palsy for almost 19 years. What are the best exercises for me to do to get my smile back? Well, to do it in one word, the best exercise you can do is facial relaxation. It's very simply formulated, simply expressed, but that's if you're asking for one exercise, yes, that will be the one. If you get an anesthetic on the affected side of your face for a dentist appointment or something, can that be a disadvantage for the facial palsy? I don't think so, because the anesthetic works on the trigeminal nerve, which is a sensory nerve. And sensory nerve is responsible for the feeling of touch, cold, hot, pressure, vibration, and pain. That's why you get anesthetic injection when you go to the dentist. Eventually, that agent, which is being injected in your face, can temporarily disable certain branches of your facial nerve, especially the buccal branch and mandibular branch. That's why sometimes you may feel difficulty to move your face directly after you have visited the dentist. But that agent, with the time, dissolves very quickly, or rather quickly, within a few hours, and it does not, and it does not cause any permanent damage to the nerve, at least from our experience.